Now we are here with another challenging case. Look at the optic disc of this patient. Is it normal? Well, I don't think so. There is something wrong with this optic disc. Now, what is wrong? The vasculature of this optic disc doesn't seem normal. Now, recall the abnormal optic disc vessel. The conditions. Well, it could be either new vessels on the disc, NVDs, or collaterals. Now remember the differentiating points of new vessels versus collaterals. New vessels would be raised with fibrous component. They are elevated from the disc. They are small caliber, they are irregular, and you will find leakage on fluorescein fundus angiography. Whereas these which I am showing, they are flat large caliber vessels and there was no leakage. So these are optociliary shunt vessels. Collaterals connect the choroidal and retinal vasculature. They could be congenital and acquired. The causes of these are acquired. So causes of acquired optociliary shunt vessels are central retinal vein occlusion, chronic glaucoma, chronic papilledema in idiopathic intracranial hypertension, optic nerve sheath meningioma, optic nerve glioma, disc drusen's. Now there are these are the lot were versatile conditions, but what is common in all these conditions? All these conditions they impair the retinal venous outflow. In these conditions there is elevated pressure of the central retinal venous circulation that lead to gradual dilatation and enlargement of these pre-existing anastomotic capillary shunt vessels, which are called opticociliary shunt vessels. And as I have already mentioned that they can be differentiated from new vessels by their larger caliber, lack of leakage and flatness. So which condition if the patient is having proptosis, decrease of vision, then you can have differential of meningioma or glioma. And if there is just old painless decrease of vision and optociliary shunt vessels, we can diagnose it as an old case of central retinal vein occlusion.